Hello, everyone, and good evening. My name is Alma Portillo. I am doing this interview for our course, which is Nursing 4502. I am going to be talking about our quality improvement initiative, the subject that I chose, which is actually bed management, centralized bed management, as a matter of fact. So, centralized bed management is an important aspect of our nursing care and the actual facilities that we work for, because centralized bed management focuses on moving the patients through the hospital, whether it be in the ER departments, as an inpatient status, in the OR, PACU, cath lab, any department in the building and the facility that we have to go ahead and move on through, admit, any admissions actually. So it is important because, we have to take care of patients in the hospital setting as inpatients. And of course, the more efficient that we are, the more effective it is to be able to move those patients through the hospital itself. The actual evidence that was used to determine what we are doing for our bed management, we are actually doing what we call PPCs, which are patient placement coordinators. And what was actually gathered has been for a couple of years now. Since 2014 to 2015, actually, they wanted to do a more centralized bed management location for our HCA, our St. David's facilities, which I've said before, we take care of all the Austin, St. David's, and including in El Paso being Las Palmas and Del Sol Medical Center as well. So we also do bed management for them too. So the initiative that the actual goal that bed management is trying to achieve, like I said, is, trying to be more efficient in bed placement, trying to be able to put the patients, place them quicker through any department that we have to deal with. Also, a lot of those jobs are typically for house supervisors / AODs. And so that also puts some ease on them and is able to give them more of the focus that they need with other issues in the hospital as well. National standards that are actually being met by addressing this initiative would just be within the HCA, the Hospital Corporation of America, the HCA facilities, and just trying to be more efficient in bed placement and things of that sort. Let's see here. Quality indicators that support the initiative would actually be, it's been, investigated as far as being able to have quicker bed placement times, the actual improvement of the hospital flow, like I said, with any department in the hospital that has to actually place patients and, assign them a bed and things of that sort. Let me see here. So the person that actually collects the data is actually, we have what we call a director of bed management, our division director, who is Daniel Wilden, that's his name. He is actually the director. When we first started bed management, bed placement, which was November of 2017, he came into our office and tried to explain to us and go over the process as far as how we go on about doing it. For me, it was something new. I've never done any kind of patient placement coordinator or any kind of house supervisor position or anything of that sort. So it was totally new to me. And not just that, it was actually also new in the process of me being being hired on at the transfer center that I'm at last June as well. So when they started the bed management in November, it was something that was also, totally new to me, trying to learn both things and get comfortable with them too. So, let's see here. Agencies that the information is reported to is actually going to be the division chief financial officer, and her name is Cindy Seitz. So that's who all of this is reported to. Determine nursing. So nursing involvement and helping with the initiative would, of course, be acting as a patient placement coordinator, a PPC, of course, being a big one. Being involved, having our voices heard, any kind of issues, obviously, that we have learning, being a PPC, and, throughput in the hospitals and things of that sort. Just having our voices heard. It's something new. A lot of us don't like change. So just kind of also being open to the idea of it, and, training itself. Not everyone is trained yet in our office to do patient placement coordinator. So that's another thing that we've been working on, as well as getting more people to be trained. I was actually one of the first people to go ahead and do or act as a PPC. So yeah, I've been able to kind of help out other people, and now kind of step aside so other people can actually take the facilities that we are currently doing, which are four actual facilities, which include our Las Palmas in El Paso, Del Sol in El Paso. We also do South Austin Medical Center, which is a huge one because it's more trauma-based as well. And we also do Round Rock Medical Center, which is also another, it's a level 2 trauma center as well. So let's see. So that's how nursing can get involved. That's how we can help with the actual, with actual bed management. People that are actually also involved in it, of course, would be our management, our, actual division director, who is Brett Steffen. We also have our nursing director, who is Guy Stevenson, our nurse manager, Whitney Babb, and of course, just us, the team, the actual registered nurses that are there, the actual team that, is actually going to be implementing the bed management system. Some of the challenges that our workplace faces in meeting these goals would be staffing issues. We're currently trying to build on our staff. I was actually talking to our division director, Brett Steffen, about it, and we, just kind of about it, overview, and 6 full-time employees were added on. We haven't been able to fill all the positions yet, but we're trying to get there slowly and surely. So, of course, that puts a little more strain on people that are doing bed management and also taking regular transfer calls or, other things that we have to do within our role there at the transfer center. So those are some of the challenges. Another challenge would be communication. We use cell phones to text, like house supervisors, any kind of movement in the hospitals. We get notifications on the cell phones as well. So just being able to coordinate with the house supervisors / AODs and actually the nursing staff on the floors, or like the PACU, and just kind of see where we need to place the patients. We also have to have a physician order to be able to place these patients on the unit that they need to go to. So that's another issue. We don't have an order. We can't move these patients to their destination because we need a physician order. So that's been something that we've also had to work with and stuff with the staff at the actual hospital. It's a little difficult not being at the hospital and kind of relying on, other people's eyes and so on and so forth. And that's where we get, our close relationship with our house supervisors. We rely on them a lot for that. So let's see. Recommendations on how nursing can alleviate some of these challenges would be just communication, just be able to talk to each other. In order to suggest the changes would be, of course, our, director, our manager, our supervisors, and other departments, just get them involved. Any kind of issues, they can go ahead and reach out to us. Like I said, we have cell phones that we get, messages through, a lot of messages via text, or they can call us, so on and so forth. Same thing. We get them involved, by communicating with them. Effective communication is key. Calling them, texting them also, because we can also text the house soups and stuff. What do I hope to accomplish in this modification would be to accomplish what the goal is, to have the centralized bed management within our facility. We do the transfers, but now we can also assign beds. So being able to be more efficient, of course, the revenue aspect of it as well, is also a big thing, of course, with any business. But, just being able to place the patients, quicker and just be more effective and efficient is definitely a big thing. Budget that was actually allotted for this implementation, this initiative, was actually the whole software itself for bed management was about 0.5, so $500,000 is what it was the total cost. And then, of course, the new 6 full-time employees, which salary ranges anywhere between 65 to 70,000. So that's another initiative. So, over 900,000 to be able to do this bed management system and just, actually being able to implement it and, the cost of it. Timeline that is determined and also what is expected of the timeline. We started November 2017. We started with 2 facilities initially. January, we added 2 more facilities on. By July of this year, we should be able to add on 2 more facilities. And so I guess our director and our management is just kind of taking it kind of month by month and just seeing how we do. So hopefully by the end of the year, we will have been able to add on all the facilities that need to be added on for bed management. So that concludes my interview. Thank you for watching and listening, and I hope you learned something about bed management. Thank you and have a good evening.